When looking at the levels of prevention, we start with the primary prevention, characteristics of the effective worksite health promotion programs. Many focus on both the individual behavior and organizational strategies that promote health. Individual is stress awareness and education, relaxation technique, cognitive coping strategies, meditation and biofeedback, lifestyle changes, increased physical activity, healthier diets, smoking cessation, and diminished alcohol intake. Additional strategies include interpersonal skill development, promotion of adequate sleep, equalization of gender workload within the family, and focusing on life priorities. Organizational level strategies are those to educate employees to lead healthier lives, advocate for company policies that promote health, increase productivity, better morale, reduce absenteeism, help to develop positive attitudes by making health promotion activities relevant to the goals and motivation of the employee group, and plan physical activities that fit easily into the workday. Illness prevention is preventing the communicable diseases using effective hygiene, adequate cleaning, disinfectant of contaminated surfaces and equipment, and use of universal precaution. The goal is to minimize presenteeism where employees are coming in sick to work. Ensure that immunization is involved, as well as following the post-exposure prophylaxis, or PEP. This is a treatment for a communicable disease following a potential occupational exposure to the infectious agent, modifying the personal risk factors, particularly those involved in the development of non-communicable conditions such as smoking. The environmental risk factor modification. Workstations can be redesigned to be more ergonomic. Minimize exposure to work toxic substances in the workplace. Minimize the effects of shift work, pharmacologic intervention which may involve agents to promote alertness and to diminish fatigue on the job or to support adequate sleep. Bright light exposure, approximately 5 times the usual indoor lighting levels, assists with adjustment of circadian rhythms. Requires a strict schedule of exposure over time, including rest days, that may be difficult for some employees or settings to achieve. There's also education and counseling and shift work legislation. Preventing workplace aggression begins with a risk assessment. Initiatives include developing a workplace culture that does not tolerate violence, implementing engineering controls and establishing administrative controls, and educating employees to minimize violence. Disaster and Preparedness and Prevention. The American Association of Occupational Health Nurses in 2012 recommends an all-hazard approach. Approaches to all types of disaster situations are identified, rather than developing response plans for different types of disasters. Here you educate about implementation of emergency measures to minimize the effects of exposures. Advocate for measures to minimize job strain. Develop flexible work schedules. Facilitate employee input into work-related decisions, strive to minimize role overload and role ambiguity, promote opportunity for social interaction, job security, career development, monitor effects of stress, employee education or environmental modification. Physical hazards are primary cause of occupation morbidity, which safety measures include the correct use of safety equipment, proper handling of hazardous substance, proper use of machinery, need for hydration in high heat areas, good body mechanics, ergonomic work areas, with safety measures including transportation safety, especially for older employees. Here the population health nurse can screen for hearing loss, fit protective devices, and educate employees and supervisors. Secondary preventions is that of surveillance and screening. Pre-employment screening is that to facilitate employee selection and placement, complete health histories, routine screening tests, which may entail criminal background checks and/or drug screenings. It also includes periodic screening, monitoring employees' continuing health status, employees working under hazardous conditions, the types of screening done and depend upon the type of job performed, the risks involved, and the capabilities required. Also environmental screening and surveillance, noise levels, surveillance treatment of existing conditions. To treat existing conditions as occupational health nurses actively involved in planning health interventions for individual employees, participate in planning health programs to meet the needs of groups of clients, need to plan to monitor the effectiveness of therapy, planning and implementing employee assistance programs for employees with psychiatric problems. This may be involved in the development and support of self-help groups within this employment setting. Emergency response to physical emergencies, which are serious accidents or from physical conditions such as heart attack, stroke, seizure disorders, and hypoglycemia. Treatment for these emergencies is usually based upon established protocols. Psych emergencies are those of homicide, suicide, or both, with general considerations of remaining calm, removing others from the immediate area. The nurse should not plan any heroic measures that may endanger him or herself, the employees, or others. Sexual assault addresses immediate physical and psych needs. Assess the client for suicidal tendencies. Refer to counseling and be alert for appropriate authorities. May need to act as an advocate with the legal and criminal justice systems and provide emotional support. Mass emergencies are those of fire or explosion, radiation exposure, hazardous substance leaks, provides treatment for those injured in such emergencies, assist in evaluating affected areas, and organize to provide needed care. Tertiary prevention is directed toward preventing reoccurrence of the health problems, limiting their consequences. Promote and maintain independence enables the employee to return to work. The goal is to remove obstacles to return to a productive work or to adapt the workplace to facilitate that return. Healthcare at this level is geared toward preventing spread of communicable diseases, reoccurrence of the other acute conditions, and complications of chronic conditions. Focusing on sick leave policies and employee immunizations are example. Assist individual employees to cope with chronic illnesses, enhance their personal coping abilities, support self-care, advocate working conditions that accommodate limitations or prevent further deterioration, advocate healthcare provider and support insurance coverage, assistance for both victims and perpetrators of workplace aggression, address anger management issues or PTSD resulting from an assault in the workplace, and assist with any legal claims. Process worker compensation claims, aftermath of a workplace disaster, identify employees suffering from physical or psychological consequences of a disaster and refer them for assistance. Assessing the emergency response and improving future responses. Implementing nursing interventions in work setting frequently involves collaboration. Obtain approval from management and engineering personnel for planning purposes by management and implemented by engineering personnel. Evaluating healthcare in work settings. The focus on the outcomes of care either for the individual employee or for the total employee population, using a set of 20 health and exposure surveillance indicators developed by the Council of State and Territorial Epidemiologists. Area of focus include demographic profile of the worker population, occupationally acquired illness, injuries, and related hospitalizations and days off work, workers' compensation claims, employment in high-risk occupations and industries, federal or state OSHA inspections and their outcomes.